Welcome, everyone. If you would like to access French interpretation, please note the instructions on the left side of your screen. If you will be listening in English, please also go to the bottom of your screen, press on the interpretation icon, and click English. This will enable you to have French to English translation if we have any participants who are speaking in French. We will get started in approximately 2 minutes. We had quite a few people who registered to attend today, so I want to give them the best opportunity possible to join us. While we are waiting to start, please do feel free to write your name and organization in the chat. Good morning, everyone. Thank you for joining. We will get started in approximately 1 minute. We still have some people who are joining, and we want to give them an opportunity to do so. So thank you for your patience, and it's really great to see so many of you on the line joining us today. Welcome, everyone. Thank you for joining. We're going to get started in approximately 30 minutes, or 30 minutes, excuse me, 30 seconds, and then we will start. We just want to give opportunity for those who are still joining. We can see that there are quite a few still logging in. So thank you. If in the meantime, you would like to write your name and organization in the chat, that would be appreciated. For those of you who are listening in English, if you could please go to the bottom of your screen and click on the interpretation button and click English, This will ensure that you can listen to French to English interpretation if we have a colleague who is speaking in French. For those who would like to access French interpretation, please do see the instructions on the left side of your screen. I think we'll get started. Those who are still joining will have a few minutes to join us as we are linking into translation. Hello, everyone. My name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor working on behalf of UNFPA's mandate to coordinate gender-based violence in emergencies. But for the purpose of today's call, I am also the chair of the Regional Emergency or the Regional GBV Working Group for East and Southern Africa. I wanted to turn on my camera for just a second to say hello, but I will turn it off because I know that we have many people joining us from different countries that have varying degrees of internet strength. So please, throughout the presentations, if you could please make sure to put your microphones on mute and also turn your cameras off, we would appreciate it. Welcome to the May version of Emerging Practice webinar series. Today we have renamed this into an advocacy brief, which we are co-hosting with the Gender in Humanitarian Action Regional Working Group, or GIHA. We thought it was important for us to specifically focus on women-led organizations and women's rights organizations in the region and beyond. We know we have quite a few colleagues joining us also from West Africa today, since we do have simultaneous interpretation into French. Really, we thought here at the Regional Working Group for East and Southern Africa, in coalition with GIHA, that it was important that we provide some context about the new humanitarian reset, or the discussions that are happening around the humanitarian reset. We also wanted to provide a platform for women-led organizations and women's rights organizations to give us reflections on this process. And finally, we also wanted to provide an opportunity to take those reflections and then use them as a springboard for advocacy, if you so choose. So this is really about advocacy, but also informational, in that we wanted to apprise everyone about what's happening at global level and potentially the impact that can have on you at country level and even further at subnational level. So we appreciate all of those who have registered and are joining us today. Since we have such a big group, we will not be asking people to come off mic to discuss. we have some interactive ways that you can provide your feedback through an ongoing survey that we will be implementing during the second session. But as always, please note that you can use the chat. Myself and my colleague, Catherine Polton from UNICEF, will be monitoring the chat. So if you have any thoughts or reflections that you see are not being maybe brought up during the discussions, the open discussions, please do write those comments in the chat, either in English or in French. As I mentioned, my colleague, Catherine Polton from the Regional UNICEF Bureau, will be monitoring the chat for those who are communicating in French, and then I will also be monitoring the chat for those who are communicating in English. So I hope that's clear. It's similar to our other forums or how we present as well. So not necessarily anything new, but we might have some new participants who are not necessarily know our way of working. So I think without any further delay, we will get started. So again, thanks everybody for joining us. This advocacy and informational briefing is in place of our May Emerging Practice webinar. And we thought it was very timely since there's a lot of things going on at country, regional, and global level that could ultimately impact the work that we do. So thank you again, everyone, for joining, and I think we'll get started. Next slide, please. We do have a full agenda today. Unlike our other webinars, this one will be 90 minutes because we wanted to give ample opportunity to all of you from our women-led organization and women's rights organizations to be able to reflect on the information. So it will be 90 minutes today. I am going to start us off. I'm going to give a brief overview of this humanitarian reset, or what's known as the humanitarian reset. Then I'm going to ask a colleague of ours from a women's network in Colombia, Erica Velosa, will speak for a few minutes to talk about the advocacy that has been taking place in Latin America from Jeune Famille. After our first session, I will then hand it over to Angie Damaningi from CARE Zimbabwe. And she is going to lead the session on reflections. And then we will end with Sunita Kamina and Beatrice Tea, who are from UN Women, but also more importantly, are also part of the GIHA network. So you'll see us to start here at the Regional GBV Working Group for East and Southern Africa. But as I mentioned, this is being co-hosted by also GIHA. And so they will be leading that last recommendations phase and then looking towards action points as well. And I think we're also going to hear from some of our women-led networks from South Sudan in that session. All right, without any further delay, we will continue. Thank you, Kabele. Next slide, please. So as many of you know, in January, we got quite a surprise in terms of funding cuts by the US government that reverberated throughout the humanitarian system. It also influenced some ways the thoughts of other donor countries. And so we saw quite a few funding cuts for GBV specifically, but across the entire humanitarian sector more broadly. And how does that impact us here in the GBV sector? Well, according to a recent OCHA survey, the GBV sector ranked second among those most affected by funding cuts. And this underscores a growing and urgent gap in life-saving support for women and girls. Many of you might have heard that we recently had a donor roundtable discussion here in the region that was sponsored by the Regional GBV Working Group, where we discussed these funding cuts and the impact, the very real impact it was having on survivors and those at risk of violence. For example, we had a local organization in Burundi that told us the devastating story of their programs being cut and having women and children on their caseload who no longer had access to life-saving antiretrovirals to treat HIV. We had a women-led organization in the DRC talk about the hundreds of women on their caseload that no longer had access to life-saving mental health and psychosocial support services due to these very severe cuts to funding in the sector. We recognize that each sector, of course, is impacted. But we today are going to talk about the unique challenges that are specific to the GBV sector. Next slide, please. Before we talk about coordination and streamlining, let's talk about GBV coordination and what's unique. Of course, we could have an entire presentation on GBV coordination, the cluster system. And there are many functions of coordination that are similar across every sector, whether it's health, whether it's education, whether it's food security, agriculture. But there are very unique elements, I think, that are specific to GBV coordination. I use this general term coordination because I know we have many people who are joining us today who might be working in countries or contexts where they have GBV working groups. We have others who might be working in contexts where they have GBV subclusters. And we have others who call them platforms. Others where it might be, for instance, in Ethiopia, where it's the GBV AOR. And so I'm using a more broad term for coordination, but it means those terms that I have just kind of outlined. So what makes us unique? Certainly there are many elements, but I want to focus on a few that I think are distinct and really have an impact when we talk about this humanitarian reset, which I will go into a little bit further. What's unique about us? I think within the GBV sector, we have a dual coordination function. First, we are expected to coordinate among partners. But second, and this is what many other sectors don't encounter, is coordination itself is an intervention. Because we must also coordinate service providers along the referral pathway. Whether it's health, whether it's protection, meaning the police or safe houses, psychosocial support, mental health, access to livelihoods. We don't build a school and then leave. Within our sector, we are also beholden to make sure that all of those partners or service providers along the referral pathway meet a distinct professional global standard of care. So this is happening usually within a case management structure. And then we also have the broader coordination function, which we often see or in terms of the GBV AOR or subcluster. And I believe we are the only sector in which we see this dual coordination function. The second, and perhaps the most important, the majority of our members are national and local organizations, many of whom are women-led. For instance, in South Sudan, the GBV subcluster has 185 partners. 185. 111 of those are national or local partners. And 65 of those are women-led. Just going to let those numbers sink in a little bit. Let's take Somalia. 85% of the GBV AOR or subcluster in Somalia are local organizations, more importantly, women-led organizations working in very hard to reach areas. And even more challenging, most probably in insecure areas. These are the places that international and even in times national organizations cannot go. And I would challenge all of us to think of another sector who has that diversity in membership. And lastly, I believe the GBV coordination mechanisms are also really the only formal platform. And I say formal because the GBV AOR is part of the formal cluster system, is the only formal platform or entry point for women's rights organizations who work on things like diversity, equity, and inclusion, who work on the rights and the agency of LGBTQI and others who are marginalized across humanitarian responses. When we talk about AAP, when we talk about PSEA, we are most closely aligned with prevention of sexual exploitation and abuse. And so I think this uniqueness is really, really important for us to take as a foundation when we further our conversations and recommendations and thoughts around coordination. Next slide. So due to these funding cuts, we know that there had to be a massive reprioritization exercise. We could not do business as usual. It wasn't possible. It isn't possible. Let me put that in the present. It's not possible. We don't have the funding. And in many would say even the political will to continue as is. And we know the current system isn't perfect. And there are certainly many, many ways that we can reimagine, and then we can also revise or revolutionize, actually, the way in which we do our work. The ERC, Tom Fletcher, who is the Emergency Relief Coordinator, so that's kind of the big top guy. He's the head of OCHA. He sits as the chair to the IASC, or the Interagency Standing Committee. He tasked pretty much the entire humanitarian system in this reset. As part of his role as the head of OCHA, the chair of the IASC, he tasked the Operational Policy and Advocacy Group, OPAG, to come up with task teams that would look into how we would actually reform in a way, right? And this is just recent. This is in the last couple of months that people at the global level have been working on these issues. They've been specifically looking at issues or thematic areas such as localization. How do we transition humanitarian aid from international into local? Which we also know, I mean, it makes sense and it's also more cost effective. It's looking at IASC reform. How do we preserve humanitarian space when maybe we have political will that does not want that? And perhaps the focus of today's discussion is one of those task teams or working groups was tasked with looking at cluster simplification and streamlining. So I want to acknowledge that there are many moving parts at global level. They're looking at localization, they're looking at humanitarian space, they're looking at IASC reform. But for the purpose of today's discussion and for our knowledge, I'm going to focus specifically on the working group that looked at cluster simplification and streamlining. That working group came up with 3 options on how we would streamline or simplify the protection cluster specifically. Of course, they looked at streamlining and simplifying the entire cluster system. But for the purpose of today's discussion, of course, I'm going to focus on what impacts us as GBV service providers. So I don't want to take away that there are lots more streamlining and simplification going on and other discussions. But since this is very focused on GBV, of course, I'm going to focus in and narrow down to the options presented on our behalf. So please note that what we're discussing today is part of a much bigger reform mechanism or exercise. So this working group came up with potentially 3 options for how we could streamline protection. And I think all of you probably know, protection encompasses housing, land, and property, child protection, mine action, and GBV. But it sounds like, for the purposes of this, the biggest discussion areas were around GBV and child protection, because we are oftentimes the biggest elements of the protection cluster at country level. So we were presented with, I shouldn't say we, at global level presented 3 potential options. 1, that GBV, gender, and PSVA become their own coordination platform. The second option is that GBV AOR is dissolved, and this would pertain to child protection as well, into a more general protection cluster. And they were specific to say no work streams, and that the functions would be under one. And then the third option that was potentially presented is that child protection and GBV merge into one coordination platform. What we have learned is that the second option is what is being put forward or recommended for endorsement by the IASC and others, such as ICFA. So what does this mean? Well, we don't know, to be honest. We don't know what this kind of being dissolved and incorporated into general protection would mean for the GBV AOR or its partners. We do know that we have all of those unique characteristics that I mentioned in the previous slide. I do know that many of the colleagues and organizations that we have spoken to are afraid that we will lose our individuality and that we will potentially lose our ability to provide specialized services to survivors and women and girls at risk of gender-based violence. And on a personal note, I am also really worried that we'll be reverting back 20 years, where women and girls did not have any emphasis, that were woefully neglected in the humanitarian response, that this would be a move backwards. And so we don't know what number 2 will look like, but we think it's important for all of you to understand the process. so that when decisions are being made at country level, you can influence those decisions, and that the senior leadership can make informed decisions based on who they know are actually doing the work. Taking all of this into account, I want to introduce the executive director of a women's network in Colombia. Erica, I think I saw you online, and I wanted to introduce Erica because they were also sort of introduced to this. And I wanted to have an opportunity for Erica Velosa, who is the executive director of the women's network in Colombia, Jeune Famille. Erica, if maybe you could spend a few minutes maybe going through some of the process in terms of Latin America and how you digested this information and what you did in response as a women-led network. Over to you, Erica Velosa, who, as I mentioned, is the executive director of Jeune Famille. Over to you, Erica.
Thank you so much, Jessica. Good morning and good afternoon for everyone there. My name is Erica Velosa. I am the director of HEMFAMI. HEMFAMI is an organization that works since 16 years old, 16 years in Colombia, and we have had the opportunity to work preventing and doing responses in gender-based violence in a national level. And we are part of different strategies of advocacy, national and international. We are signatories of the CTA against gender-based violence in humanitarian context. And we are, since the last year, we are co-leaders of the gender-based violence space that connect the AOR response in Colombia. We are co-leaders with UNFPA and UN Women. And for us, it's a very interesting process, what is happening now. We are facing a very, as in other parts of the world, a very strange times related with how we expected the evolution of the humanitarian system and a humanitarian system that could be more open to the participation of the women-led organizations, to the co-leaderships, to the different kind of actions. And we started to see that in the last year with different strategies, and we have even part of groups of response and reflections related with other women-led organizations in different regions. So it has been very interesting to see how this situation since January has dynamited all the situations that we expected to be improved, that are implying that everything is in risk right now. So we have seen with a lot of concern what is happening, for example, in countries like Colombia, where the 92% of the response related with migration has finished after the cancellation of the funds, or how the gender-based violence response has reduced it in at least 56% on the field, when we have seen at the same time a big increase of the actions related with armed conflict. Last year was the worst year in data related with the events of armed conflict as after the peace agreement that we had 8 years ago. And at the same time, we have this big flu migration coming from Venezuela that is increasing, and at the same time we are reducing our action with the population that is coming as migrants in Colombia. So because they are not yet refugees, no? So we are very, very concerned, and what we have is to see with other colleagues from other countries and to use the platforms that we have in connection. We are part of a very beautiful strategy that is the CAFI strategy that connects and create networks of women-led organizations in different countries. We are the leaders in Colombia of this network. And we have some colleagues in Venezuela that are the leaders of Net Cafe in Venezuela. So what we have been doing the couple of last year is working in a binational roadmap for working in different areas, including the advocacy processes. And as we are part of this big process, we are connected with the networks of other 8 countries in Asia and Africa. So it has to be part of a network like that is a very diverse and connect us with other regions, other realities, other situations, has maybe give us a broader vision about what is happening and how the women-led organizations are being affected in all this process. And we have had the opportunity to discuss about this action. So of course, our advocacy is not coming only of our thoughts as FEMFAMI. Our advocacy is connected with all these discussions, reflections, and the power of being joined with a lot of powerful women, with a lot of different organizations that have different strengths. So what we have been thinking in this process when we thought about this situation, about the reset, and of course with this situation particularly related with gender-based violence, this is a moment of the humanitarian system is in risk, and of course the vision of related with the gender-based violence and other situations related with protection are in risk in a conditions where the risks are absolutely increased. At the same time, we see that in our case, the violence is not marginal, is central in each crisis. And what we think it's not possible that we see that the spaces are closing and the possibilities to be civilized and show what is happening are reducing with this kind of decisions. And at the same time, we think are decisions that are practical, that are connected with funds, but are not seeing what are the needs of the population and are not seeing what is the need to put more actions for preventing and respond and managing risks for the population. So what we think is the reduction of these spaces of focalize it to see and to evaluate and to create responses based on gender-based violence. It's something that could be a big damage on the time related with this subject, because what is not safe, what is not open, with the time stop to exist. And what we think it's very important that this subject could be managed, could be shown, we need to do even more advocacy for other people into the clusters, other people into the humanitarian system, in the governments, even with donors, could see this a big problem that affect in a very deep way the life of the people. At the same time, even when we think that the system needs to be improved and we need to see better equality interaction between agencies, spaces of coordination, and women-led organizations, we see that it's important to have this a structure that led us to be part of that. And at the same time, we need to see more leadership related with women-led organizations and more spaces open, because we can do even an advocacy that other spaces or other colleagues cannot do. At the same time, we have seen how the risk of the financial steps that we were expecting, that the grant bargain and the flexible and core funding could be increased for the women-led organization. We see with this situation, it's going to be less, it's going to be affected. And this action that we could have more actions in the first line of response that could have more possibilities to develop strategic actions and prevent and respond violence could be very affected with this kind of decision, because it's not going to be in the looking for these kind of funds are going to be reduced. At the same time, what we think is we need to continue doing these works, and what we have been doing is create a letter that we could connect with some of these aspects with these issues in the letter, explaining why we think as organizations that it's not correct and right decision to desescalate or reduce the gender-based violence spaces that are spaces for working specialized in these subjects, and at the same time how it even is necessary to develop and guarantees well, to say and to ensure that these organizations could be part of the response, could be part of the leaderships in different regions, and at the same time could show with a strong voice of different organizations about this. So what we do with our colleagues from Venezuela in this roadmap that we have, and with the support of other organizations in Latin America, is create this letter that joins some of these points and create an alert, red flag to say this is not happening in our watch, or at least we need to do something. And in that sense, what we want to do is create a collective action that we invite to join for that we could say, at least as women-led organizations and other civil society organizations, what are our thoughts related with that? And what we invite to do is maybe to check this letter if you are agree with these points that we are selecting here, that maybe you could join us in this process. But at the same time, if you have your own views, if you have your own ideas about what we should do better and as a humanitarian system, and the people who is making these decisions, maybe to create your own document your own letters and to put these letters on the people who are making the decisions. And at the same time, I think it's a very good moment for taking in advance this opportunity, because it's the way that we could elevate our voices, to put our thoughts in this discussion, to be listened, we hope. And at the same time, that maybe that even could be better for improving the humanitarian system that is happening today. No? And in that sense, what we do is to invite to mobilize our ideas in a collective way, of, if you prefer, in different, with your own strategies, resources, and actions of advocacy. But we think it's a moment that we need to elevate our voices for protecting the rights of the people that we serve, and at the same time to show the power of the women-led organizations and other civil society organizations. We move the humanitarian system in the first line. We create the spaces with the communities, and we have the knowledge for how to do it. And we are not only women, civil society based in community, where a lot of us have a lot of different strengths, and together could show a big force for facing these interesting and complex times. Thank you.
Great. Thank you so much, Erica. I just want to note, just to reflect on some of the things that Erica mentioned, and then I'm going to turn it over to Angie. Erica, you mentioned, I think, some really interesting points for us to reflect on here in East and Southern Africa. First, it's the power. It's not just Erica's organization, it's a consortium of women-led organizations from across the region who have taken umbrage to this point, right? Who have taken lead on this point. I have put in the chat the letter that they have written. It has now been translated into multiple languages. So it's gone beyond Spanish to English to Arabic. I think Portuguese might have now into French. And so if you would like to sign this letter, first read it so you understand what you're signing, of course. But if you'd like to read their letter in full, you can find it on the link I put in the chat. And then you can also sign the letter on the link above it. But I thought it was interesting, and thank you again, Erica, because it's very early in the morning in Colombia, which just shows, Erica, really the energy that you have around this issue. and how your needs and wants might look slightly different, but are in many ways the same as what we're probably advocating for here in East and Southern Africa. And it's so uniting, I think, right? In that you who live in Colombia, which seems really is on the other side of the world, are also fighting for the same, for the leadership, for the space, for the recognition in terms of how we do our work, and more importantly, your place in it, how you're centered in it. So thank you, Erica, for letting us think a little bit about what the process is like in Latin America, particularly what they have done with this information, how they've digested it, and then springboarded into action. So I think this is a good segue maybe into our second session, which is going to be led by Angie, as I mentioned, from CARE Zimbabwe. Angie, I'm going to turn it over to you as a great transition now that we've heard about some of this work in action from our colleagues in Latin America. I'm going to not even say our colleagues, our sisters in Latin America. And I'm going to turn it over to you, which is really now about reflecting what are our wants, right? What do we want here in East and Southern Africa, and beyond that in West Africa? Because I know we have many of our women-led organizations and women rights organizations from West Africa as well, and around the world joining us. And so I turn it over to Angie. Thank you. And thank you again, Erica. Over.
Thank you so much.
Great. Thank you so much, Jessica and Erica, for those insightful presentations. My name is Angeline Dawaning, and I'm the gender advisor for CARE Zimbabwe. And I'm also happen to be the coordinator for the Eastern Southern Africa region Women-Led Organization Network in Humanitarian Action. So this segment, we want to reflect on the presentation from Jessica around the humanitarian restructuring. And this is an opportunity for all of us here to share our views. And I think you have heard from Jessica's presentation that the GBV coordination is unique because of this, its dual coordination, and also it houses the majority of the local women-led organization, and it's also the only platform providing, acting as an entry point for women rights organizations. And here are the propositions in terms of streamlining coordination. Number one, GBV Gender and PSEA to become one coordination platform. GBV AOR dissolved into a general protection cluster, and also GBV child protection being made into one coordination platform. So on this, in this segment, we want to hear from the voices from the women-led organization in the East and Southern Africa, and also West Africa, and everyone else here present, about your perspective about these vital discussions about the ongoing restructuring processes. To help us facilitate this segment, I have put a poll. There's a poll here that you can see. So number one, the question is, which of the following proposals regarding the GBV AOR restructuring do you support? So there are so many choices, about 4 choices. The first choice, GBV AOR dissolved and incorporated into protection cluster. The second choice, GBV, Gender and PSEA form a coordination platform. The third option, child protection and GBV become their own coordination platform. And then the last option is to have a standalone GBV coordination platform. So please feel free to add your views. And please, Jessica and Catherine, help me to monitor the chat and see how people are responding also in the chat. So feel free to respond in the chat. Feel free to also choose your choice in the poll shared on your screen. I'm seeing people voting. So many people are suggesting, or the majority suggesting that GBV, Gender, and PSEA form a coordination platform. That one is leading so far. We have that followed by child protection and GBV becoming their own coordination platform. Also followed by having a standalone GBV coordination platform. Keep them coming. We have about 110 so far, and we are about 400 in this meeting. Happy to see these different views coming from the women-led organizations themselves. So still, the second option is still leading with GBV, Gender, and PSEA becoming a coordination platform, still followed by combining child protection and GBV to become one coordination platform, and also views around having a standalone GBV coordination platform. About 150 have voted so far. Feel free to put your voices in the chat if you are finding it difficult to use the poll.
Angeline, quite a few third options in the chat from the Francophone contingent. Well, not just the
Yes.
Francophone, but certainly a lot of options 3 in the chat, just FYI. Couple of options too.
3, the child protection and GBV becoming their own coordination platform. Okay.
I don't know. I just can tell you there's a lot of options 3 and some options 2 in the chat.
Yes, so option 2 is GBV, Gender, and PSEA forming a coordination platform. And option 3 is child protection and GBV becoming their own coordination platform. And this is almost now in terms of numbers equal to the fourth option, which is about standalone GBV coordination platform. So we have 23% voting for a standalone GBV platform, and then 23% voting for merging GBV with child protection. And we still have the second option, GBV, Gender, and PSEA forming a coordination platform.
Do we know if is there a French version of the questionnaire?
No, Catherine, unfortunately, there's not. But what we were doing is trying to read out the questions so that then the interpreters could interpret them as Angeline was reading them out.
Okay, let me read that question again once more.
I think really slowly, Angie. Maybe start with question 1 and then each of the possibilities.
Yes. So question 1, which of the following proposals regarding the GBV AOR restructuring do you support? Option 1, GBV AOR dissolved and incorporated into protection cluster. Option 2, GBV, Gender, and PSEA form a coordination platform. Option C, child protection and GBV become their own coordination platform. And then the last option, a standalone GBV coordination platform. All right. More votes are still coming. We are about to get to 200 out of 400, so about 50% of people have voted now. Still, we have option 2, which is GBV, gender, and PSEA form a coordination platform leading. So the majority have opted for option 2. And Jessica said also in the chat, we have so many people voting for option 2 and 3. So option 3 is also the second voted so far. The child protection and GBV becoming their own coordination platform. And then followed by having a standalone GBV coordination platform. And lastly, the first option of merging GBV and protection into one cluster. All right, so I think I don't know, Jessica, can we move to question 2 or?
I think so, yes.
Yeah, I'm moving to question 2, but if you have any other views, please feel free to use the chat as well and also keep on voting. Question 2, I'll read slowly again to allow for French translations. So question 2, do you feel adequately consulted in the discussions surrounding the restructuring of GBV and protection coordination? So here we've got 3 options. The first option is yes. The second option is no. The last option is somewhat. So those are the 3 options. I will read the question again. Do you feel adequately consulted in the discussions surrounding the restructuring of GBV and protection coordination? The first option, yes. The second option, no. And the last option, somewhat. So in the poll, we are seeing the majority voting no. Followed by yes. And then lastly, somewhat. So far, 39% are saying no, we don't feel adequately consulted in the discussion surrounding the restructuring of GBV protection coordination. And then 35% saying they feel consulted. And then 26% feeling that they are somewhat consulted. I'll read the question again once more. The second question, do you feel adequately consulted in the discussion surrounding the restructuring of GBV and protection coordination? The options, number 1, yes. Option 2, no. Option 3, somewhat. And I'm also seeing in the chat, Jessica, do you want to highlight some responses in the chat, Jessica and Catherine? Please feel free to come in.
I think we're getting a lot of no's on this question generally in the chat. Yeah.
Thank you.
I think we can move on to the next or last. Yeah.
Yeah. So the third question, reads, does the current restructuring process reflect your views and the needs of your organization? People have started voting already. The first option, yes. The second answer, no. The third answer, partially. I'll read the question again. Does the current restructuring process reflect your views and the needs of your organization? The first option, yes. Second option, no. And lastly, the third option, partially. Here, we are seeing the majority of people responding partially, 44% saying yes. The current restructuring process reflects partially the views and the views of and the needs of our organization. And then 33% saying yes, it does reflect our views and the needs of our organization. And 23% saying no, it doesn't. So again, in the chat, I'm seeing some yes, some no. But here on the poll, the majority are agreeing, 43% still agreeing that it partially reflects their views and those of their organization. Yeah. Moving on to the last question. So question 4 reads, how have you been engaged in current discussions around humanitarian sector and GBV coordination reforms? I'll read the question again. How have you engaged in current discussions around humanitarian sector and GBV coordination reforms? The first option, I'm a member of a GBV coordination group. The second option, I'm not in any coordination groups, but aware that they do exist. So here we have three options. The third option, I'm not familiar with the GBV coordination structures in my context. So I'll read the last question again. Question 4, how are you engaged in current discussions around humanitarian sector and GBV coordination reforms? So here I want to see your level of participation and involvement in humanitarian sector and GBV coordination reforms. So the first answer, I'm a member of a GBV coordination group. The second option, I'm not in any coordination group, but I'm aware that they do exist. And then the last option, I'm not in any coordination groups, but aware that they exist. So these are the views coming from the women-led organization. So the majority on this question are saying they are members of GBV coordination group. So it's about 68%. And 28% are not in any coordination group, but they are aware that these coordination platforms exist, and then 4% are not familiar at all with the GBV coordination structures in their context. Great. So on this question, we have about 238 respondents, almost same as the third question and the previous questions. Yeah, equally the same number of people voted for the 4 questions. So thank you very much for your input into this discussion, restructuring discussions, and your views are very, very important, and they're going to shape what is going to happen, you know, in the restructuring process of GBV and protection coordination. Jessica, any views from the groups that you'd want to highlight?
It's a mix, I think, coming from the chat. And now we're on multiple questions. So I think it's going to be interesting for us to share the results so that everybody can now see the results of those questions that you just asked.
Right.
I'm able to see the results. Catherine, can you see the results on your screen? We've now switched over to sharing the results.
Huh. Is Sunita still in to help, maybe sharing?
It's sharing on my side. I don't know if participants can see it.
Yes,
yeah,
we're getting confirmation.
Oh, great. Yes, wonderful. Thank you.
So as we can see, we had over half of our group complete the survey online. And then we also had many who gave their reflections in the chat, which I think mirror actually what we're seeing here.
Yeah.
Over to
you,
Angie.
So thank you so much once again for your great participation on this poll. And like I mentioned, your views are very important for the team that is working on the restructuring process. And as I have said, the majority are against the dissolving of incorporating or maybe GBV or are being dissolved and incorporated into the protection cluster, but suggesting that we have GBV, gender, and PSEA forming a coordination platform, just to summarize, and others suggesting merging child protection and GBV to become one coordination platform, and also having other 20% feeling that they need a standalone GBV coordination platform. Then in terms of consultation, again, the majority, they don't feel consulted enough. So 39% are saying we are not consulted, and then 25% are saying we are somewhat consulted, and then 35% saying they are consulted. And then around the current restructuring process, the majority are saying, so about 43%, they are saying that the current restructuring process reflects partially their views and the views of their and the needs of their organization, whilst 34% are agreeing to say they do reflect their views and also the needs of their organization. 23% saying they don't reflect their views and those of their organization. And then lastly, in terms of engagement in the current discussions around humanitarian sector and GBV coordination, we have the majority being members of a GBV coordination group, about 69%, and then about 27%, they are not in any coordination group, but are aware that these coordination groups do exist. And then 4% are not familiar with the GBV coordination structures in their context. So Thank you very much for sharing your views. And at this moment in time, I'm going to hand over to Beatrice, or maybe back to you, Jessica. Thank you very much.
Thank you, Angie. That was really useful to just get a little bit of to gauge maybe what we're all thinking about. The last question we specifically put in because we wanted to understand how you're engaging in this discussion, whether as a member of a coordination group, whether you are not in one or you're familiar. This gives us an indication of also where your information is coming from and others. So to put it into context in terms of where you're meeting us at in a way. So knowing this, we have a bit of a foundation now, I think. I think we're going to turn it over to Beatrice from UN Women, but on behalf of the GIHA Network, which is the Gender and Humanitarian Action Regional Working Group, to sort of take us through what could be potentially the next steps. We heard from Erica Velosa in Colombia, what they did in Latin America. Let's transition now to East and Southern Africa. We have a bit of context and foundation. Over to you, Beatrice.
Thank you so much, Jessica. Thank you, Angie, for a very good session. Good afternoon, everyone. Good morning. My name is Beatrice. I work with UN Women on humanitarian and disaster risk reduction. Very happy to see all of you here. I'm also part of the Gender in Humanitarian Network within the East and Southern Africa region. Now, having heard from Jessica, having heard from a colleague from Latin America, and also seeing the survey and the session that we've had with Angelina, we are now moving to the last session. What do we do with this information that we have? What are some of the recommendations that we are going to make as women and women-led organization within this region? What are some of the advocacy efforts? Are you hearing me? Please confirm.
Yes, we can hear you, Beatrice.
You can hear me. Somebody was saying no sound. Okay, great if you can hear me. So I was saying we are moving to an exciting session in terms of recommendations and way forward. And to start us off, I would like to request a colleague from South Sudan, Anna Tacita, the director for Women Change, to share some of the experience that they have had from South Sudan. Part of us being here is to learn of what's going on within our region so that we can borrow some of those best practices. So Anna, if you can hear me, please take the floor for a few minutes, about 3-4 minutes, to share your experience from South Sudan before we can move forward. Anna, over to you. Thank you. Anna? Can somebody unmute Anna, please? Whoever, I think Jessica, could we have Anna?
I am trying to see if she can.
Okay.
Yeah.
Yes.
Thank you. Good afternoon from Juba, South Sudan to everyone. I know it might be morning or evening in other parts of the world. I'm Anna Tazita Samuel. I'm the Executive Director of Women for Change, a women's rights organization in South Sudan. However, in today's, I'm representing the voices of the South Sudan Women-led Network in South Sudan. So our experience, basically, I wanted to go straight to of course, the saddening news when the women-led organization were taken by shock due to the global funding crisis. The GBV era might need to be merged together with the protection cluster or the protection cluster. So as women-led organization, because of the importance of having the GBVLR and how the GBVLR have supported us in our intervention in reaching the unreached areas in handling key issues, especially in the context of South Sudan, where there are a lot of GBV issues, there are a lot of SIA, there are a lot of funding gaps for women-led organization. We felt it is a platform. Our voices are going to be closed. And because of that, we, as the women-led organization, came together to put a position paper to really to share with the UN, representative in South Sudan. The GBV is not matched because we have a lot of experience. One, the GBV has been giving us a platform as women-led organization where out of
Did we lose Anna? I can't hear her.
Yeah.
Anna?
We've lost the sound.
the GBLR, I think for the first of its time that a women-led organization is coordinating is co-leading at the national level, which has really enabled our voices to be heard at the global level.
Anna, we lost you again. I think it's internet. Anna, can you hear us?
If the GBLR is really matched, it will affect us. And also, we have an aspect of the response to the women, to the women and the children in the country. The response to the survivors of GBV understand, where we have a lot of cases of violence against women from intentional and unintentional crisis. We felt, and the response that the women-led organization have really been responding to the sensitive management of the cases. We feel it is not really viable. It's not really fair for us to see that we emerge in a mainstream, which the women of South Sudan will greatly suffer. The children of South Sudan, especially the girls, will really suffer because services will not reach to them to the doorstep. Hard to reach areas might not be reached, and we shall have a lot of issues in regards to GBV in South Sudan. So due to all those importance, we sat down, we have a position paper, which I think it can also be shared here later on. And we felt that we mobilized ourselves as women-led organization because we already have the platform created for us by, of course, one of the agents, and we feel that we could really prefer, especially in the context of South Sudan, of course, globally and everywhere, especially in the global South and East Africa, we really feel that having the GBV era being a standalone will save a lot of lives, will continue to advocate for our voices, will continue to serve the unserved that are really in the community, and will continue to strengthen the tracking of sensitive and tracking of information in safe and having a very safe referral, having a very safe information, and also enabling the women-led organization to have accurate information, to have hands-on information for access for every aspect of our our operation in South Sudan. So that is something that we really felt it is important. And we also through the GBVLR, we are able to advocate for policy breakthroughs, such as the ratification of the Mobutu Protocol in 2023. And it's because of this policy that our dear president is able to even sign the policy, and it is all because of this platform. So we really feel that in a country where there are a lot of displacement due to conflict, due to flooding, we really feel that, and the GBVR has been in front line enabling the women-led organization to even have the access to be in the joint rapid assessment that takes place, rapid need assessment. And that also enabled the women-led organization to have their capacity strengthened in terms of carrying out assessment and responding and gathering resources. We feel that we really need to have the GBOR have a stand-alone, especially in really our context that, because we know there are different contexts. In other contexts, we may say it is good to merge with the PSA, it's good to merge with the child protection, but in our South Sudan context, it's really something that we feel as women's rights organization, we wanted it to have it a standalone to see that we continue to offer the services, WLOs continue to respond effectively in South Sudan. So that is the experience that basically I wanted to share about what we have had and what we have taken forward. But moving forward, of course, we are still waiting to have a response from Ms. Kiki, who is the Deputy Special Representative of the Secretary General to South Sudan in regards to our position paper. And of course, we shall be also sharing the feedback later on. But for now, that is what we have done as Women-led Organization of South Sudan. And not just because we want the GBOR to be standalone, but because of the importance, really the importance of this platform for us as Women-led Organization, and how it has helped us as a women organization to in the context of South Sudan. That's why we wanted it really to have it that way. Thank you so much, and thank you, Jessica. Thank you, Beatrice, for giving the South Sudan Women-led Organization Network the voice, the forum, the time to share what we have from South Sudan, the development we have in South Sudan regards to this current topic. Thank you so much.
Thank you so much, Anna. That's really powerful. A few points coming out. I think the importance of coming together, working together on advocacy paper. That's very critical, and I think that paper will be shared with the stakeholders. And also highlighting the contribution of women-led organizations, not just on GBV, but also humanitarian interventions within South Sudan and across the region. I think that your situation in South Sudan mirrors many countries within our region, and that the fact that you work with those that are likely to be left behind. A key principle that we work with as humanitarians in terms of leaving no one behind, amplifying the voices of women within this process, ability to engage in policy dialogue, which has also influenced some of the key decisions within the government of Sudan, and I believe within various governments in our region where women and women-led organizations have contributed. I've seen some requests from others. Given the time, please, you can add your contribution within the chat so that we are able to move forward. We do also have a few questions that we would be putting as a survey in terms of how to go forward so that we can have your suggestions recorded in terms of our way forward so that we can be able to put them together. So the questions have already been put on the chat. There are 3 questions. and I would read them slowly so that we can have our interpreters also be able to interpret for our colleagues. The first question in terms of our way forward is, what do you see as entry points for advocacy at country and regional levels for ensuring GBV coordination needs are met? So very short answers, please. If you can give us very, very short answers on the survey. Please confirm that you can see the survey. So we are dealing with question number 1. What are some of the key entry points? We've heard from South Sudan. We've heard from Latin America, some of the things that they have done. Please, if you can give us some short answers, we would appreciate. Please confirm you're able to see. Can I see even from the chat that you're able to see the survey? Yes, a few yeses, please, so that we can I can confirm that. Hi, colleagues. Are you seeing the survey? Yes. Okay, great.
Yes.
Great. Yeah, great. Okay. Please, if you can give us a short answers, please. What do you see as entry points for advocacy at country and regional levels for ensuring GBV coordination needs are met? You can also use the chat function. Jessica and Catherine will be monitoring the chat function. Please, I have not seen any response yet. Please, if you can respond. Short answers. Okay. Suni, for some reason, I can't see that on the screen. Is that the
So I
answers
think
on the
because
screen?
this is open-ended, we'll only be able to see at the end, but I can see that we have
Okay.
so far 9 responses. So there are some
Yes.
coming in as well as in the chat.
Okay. All right. Yes, yes. Coordination, I can see in the chat coordination with OCHA, research to be driven by lessons learned, efficiency and effectiveness. I think humanitarian response plans ensure GBV is prioritized as a life-saving. Yeah. Entry points for advocates at the regional level to strengthen solidarity between women-led organizations. Okay, please continue. Continue sending your response. I see 19 already. For question 2, I see already 21. Question 3, 22. Please continue. And then we would ask Sunita maybe to highlight some of the things that are coming out from the survey. Please continue. We are seeing your response. Question 1, what do you see as entry points for advocacy at country and regional level for ensuring GBV coordination needs are met? Question 2, what would assist you to engage in advocacy as part of the reset discussion? Question 3, what's your one key message to decision makers on GBV? This forum gives us a chance to amplify our voices and to add our voices to the current discussions of the humanitarian reset. So yes, please keep your responses coming. We are at 9%. Please, let's continue responding. Okay, so far we have 35 responses. Please let's keep our responses coming. 36, 30, yes, please. Okay, let's continue. We are at 40 participants. That's well done. Let's continue.
I don't have access to the question, please. I don't see it on the screen.
Suni, please, where can the participants get the survey?
I'm putting the link, if you open, there's a link to a site in Zoom, and there's a QR code, and you can scan that code to access the questions. I hope that is working for those who have tried it.
Okay.
Yes, please. For those who haven't had a chance to access, please access the question, open questions at Zoom. Okay, let's keep, yes, we're at 50, almost 14% of the participants. Let's keep, I know this requires a bit of time, but please let's keep our voices coming. Jessica and Catherine, please monitor the chats. I'll be asking you to provide some summary on what's happening on the chat. Good, we are at 55 participants that have responded. Okay, we are good. Almost we are at 60. That's good. Let's continue. That's really good.
Beatrice, we have about 5 minutes before the end.
Yes, yes. So maybe once we get to 70, we can stop here and then we get a summary. But just to mention that GBV and gender are really critical for effective humanitarian response. And therefore, it's important that they are part of the current discussion, current humanitarian research. And therefore, your voices are really, really important and critical in terms of shaping some of these discussions, hence this forum. So we'll be closing in 1 minute. Please, those that have not yet given their response. In the meantime, Jessica, please, you can summarize some of the things that are coming on the chat as we complete the poll in a few minutes. Jessica?
I will. And we only have 5 minutes till the close of the webinar. So maybe while we're sharing those results, I can also maybe do a summary of our discussions today, if that's
Yes,
okay,
please.
Beatrice.
Yes,
okay.
so you can summarize both what is coming in the poll and our summary of today. Thank you, Jessica.
Great, thank you. So just to summarize, I know that we're about 5 minutes over time, so we will be ending here. I just want everyone to think about the humanitarian reset, specifically those areas that we spoke about, how women-led organizations and women's rights organizations are going to be represented in this reset. For us, we think it's extremely important that you are at the center of these discussions, because we know that you are the frontline service providers. You make up the majority of our coordination platforms. And we also know if OPAG, which is the IASC or the Operational Policy and Advocacy Group, imagine at the same time that they're looking at streamlining coordination or simplifying coordination, They're also talking very extensively about how we focus on localization. And so these two, in respect to our sector, are somewhat at odds. So in some ways, it seems like they're trying to minimize the presence of our membership into this more generalized protection cluster. Yet in the same token, they're also trying to really focus on localization. And I think that in itself is in conflict. If we're serious about localization, then we have to let our local partners lead, which in the GBV AOR, we know at subnational level and even national level, as Anna has said, she's the co-chair, co-coordinator of the GBV AOR in South Sudan. And so this leads us into how we want to see ourselves within this new, I guess, reformed system. And it's not for us here who are facilitating this discussion to tell you that. We're here to give you the information. We're also here to show you or to introduce you to what some other countries and regions have done in response to this news. There's a whole network of women-led organizations in Latin America that came together very quickly in this past week. They developed briefing notes, they developed messaging around this issue, and then they also developed the global petition and then letters that were signed and sent to very senior leadership, both in the region and globally. We've seen in South Sudan that they've been working on this for weeks, really, about centering themselves in this discussion. The result was this position paper that they very thoughtfully put together and then sent to senior leadership at country level, regional level, and also at global level. So as a summary, I challenge all of you on the line today to say, what are you going to do to make sure that your voices are heard and then your rights and needs and the agencies in which you work are promoted and sustained? Because we know that coordination is also directly linked to funding. And so we really encourage you to go back to your networks, to discuss what's happening, and to come up with a plan for advocacy, if you so choose. But we thought it only fair that you could do this in a more informed way, because many of our partners have said they didn't even know this was going on at global level. If you would like to reach out to the GIHA network, for instance, in your countries, you can always link up. You can link up also to so many others. If you have a GBV working group or a GBV coordination group in your country, please do link up with them to learn more. But really, this is a time for you to think about the future of humanitarian prevention and response. How we want this new ways of working to look. And so we really encourage all of you, just like it happened, as I mentioned, in so many other countries, in Iraq, in Sudan, in places like Colombia and Venezuela and South Sudan, to really think about how you would like to see and what you can do in terms of advocacy. We did put links. As I mentioned, we put links throughout the chat to the materials that were produced by our colleagues in Latin America. So please do, if you see, I can maybe right here at the end, try and do that again. We also posted the position paper that was developed by our colleagues in South Sudan. Again, I want to stress that this is not a venue or a forum for us to express our ideas and needs and wants. It's really, we facilitated this so you could start thinking about what you want to do in order to affect change. And you have a very small timeline to do it within. And I think based on what we see here from these questions in the polls, we see that a lot of what you wrote in the chat, certainly we had some practical recommendations about including more donor-specific language, about making sure that GBV is represented as life-saving in the HRPs. But more importantly, I saw a very big trend of all of you saying we need to work together. We need to start networking. And these are the phrases you were using. We need to have a joint statement. And when we say we, that's you, all of you who are representatives from women-led organizations and women rights organizations. And you can't, I mean, we've seen success, and we can make sure that we can be a vehicle for you if you have additional questions. I'm going to turn it over to my colleagues at the Gender and Humanitarian Action Regional Working Group, to Sunita, to maybe do some last final thoughts while I put more links into the chat. Sunita, just a couple more final thoughts, and then we'll end.
Okay, thank you so much, Jessica, and thank you all for staying with us. I know it's gone longer, but really valuable insights and sharing of ideas, and we will consolidate and look at the best way to get these back to all of you, but also to note that this is not the first nor the last conversation. I think the call here today was really clear on that point around collaboration and the need to continue to find these spaces where we can build and strengthen our solidarity with each other, with the advocacy messages, and amplify the points in whatever platforms that we all have, because we are in different spaces. And I think this collaboration between the GIHA working group, the Regional GBV working group, is an example of that opportunity, that solidarity that we will look to continue to promote and enhance as we move forward. I won't keep it much longer, but just again, gratitude for being part of this conversation, sharing, and please do feel free to reach out if you feel the need for further information. Thanks, and back to you, Jessica.
Thanks, Sunita. As mentioned, we will be collating all of this information and hopefully being able to share a one-pager back to you with the key figures and thoughts that you all were able to give us. And then again, we hope you use that information as a springboard for advocacy. So thanks again, everybody, for joining. It was really great to see you all online and very much engaged. On behalf of the Regional GBV Working Group for East and Southern Africa, my name is Jessica Gorham. And on behalf of GIHA, which is the Gender and Humanitarian Action Regional Working Group, I'm happy to have Angie as well from CARE Zimbabwe, Erica Velosa from a Women's Network in Latin America, Anna Tazita from our Women's Network in South Sudan, and all of our members joining us today. Thank you so much, and we will see you soon, because it's our job to also keep you updated on all of those things that are going on at global level. So as Sunita said, this is the beginning of our conversation, but it's quickly moving. So if you're feeling inspired, everyone on the line, make sure that you're linking up within your networks to see how you can initiate change. So we really appreciate all of you, and I hope you have a great afternoon.
Great. Thank you.